But first, it's the final countdown. Senate Republican leaders expected to release, quote, a discussion draft of their long-awaited health care bill tomorrow morning, and Mitch McConnell is pushing for a vote before the July 4th recess. But after weeks of secret meetings that even shut out party members, GOP, well, they are wondering if they're garner enough votes for this to finally repeal and replace Obamacare once and for all. If not, this would be a monumental disaster. Here to discuss, Tammy Bruce, Ford O Connell, and Lena Epstein. I want to start with you, Tammy. The moment of truth is upon us. This is the first in a long line of dominoes that have to go through. Yeah. It could perhaps be the biggest legislative win because it makes everything else easier. It's been crafted in secret. Mike Lee, just one of the many Republican senators who are upset about that. How are you assessing this?
I think this is obviously part and parcel of how legislation is done. Very often, you know, it's been so long since actual legislation's been crafted. With Obama, we never really got to see it, right? So this is for some people kind of new to see. So I'm not very concerned about that. But what we do know also, there are so many divisions, and this is Republican leadership fault, in the actual end result. It would have gone smoother if they'd been focused over the last several years. I believe that they're shutting certain people out so they can actually get something done. We hear that the Senate version, though, is actually very similar to the House version, which could be somewhat helpful. But in the end, whatever it is that gets announced tomorrow, whatever ends up coming out will probably not look anything like it, but it'll give you a sense of where they're headed. A big deal is, in fact, the opioid epidemic and money for that as well, and Medicaid. So you're looking at entitlement dynamics that are affected. This is what they're going to have to deal with, and we've got to have something. We can't keep obviously, it's already collapsing, Obamacare, and it's about getting it done so that we can move forward. Some want to stop Trump completely. They're going to try to do that. We'll make sure that that doesn't happen.
Ford, you know, of course, the first try in the House was a flop. Since then, the House put through a bill that now President Trump is calling somewhat mean. To me, that means that this particular version that we get tomorrow morning will have fewer savings. That goes to the baseline, but probably will be more palatable to some of those red state Republicans, particularly where you see Medicaid expansion. What do you think?
I think you're absolutely right. And to Tammy's point, failure is not an option. Look, Republicans have been campaigning on this for 7 years, and they have to recognize that their numbers in both the House and the Senate are not going to get any better than they are right now, particularly with the prospect of losing the House in the 2018 midterms. And I will say one more thing. They have to understand that they serve at the privilege of their voters, and their job was not meant to be a lifetime appointment. Some of them are going to have to walk the plank, but they have to do America's business. And to McConnell's point about doing this in secrecy, look, I don't like it either, but you know what? It was necessary to do because there's three things I know on this earth to be true, Charles. Death, taxes, and Democrats were never going to help us on the Obamacare replacement.
Yeah.
Lena, you're an uppercomer in the party, and it's a party that's somewhat divided. There's several ideologies. On one hand, you've got the Freedom Caucus, which represents conservatives. On the other hand, you have the Tuesday group, and it felt like they went back and forth. I would suggest that the House bill favored the Tuesday group a little bit more. So tomorrow morning may put more pressure on conservatives. How do you see it working out?
I wouldn't disagree with what you said as far as the divisiveness within the Republican Party. One of the reasons that I chose to run for office was to bring unity to the party because ultimately, Charles, Americans want the same fundamental things. We want freedom. We want opportunity. We want health care options that are going to work for our families. America spoke loud and clear in 2016 that they were looking for a change. The fact that our senators are working hard to find that change, along with members of the House, is very encouraging. And as far as Senator like Mike Lee is concerned, I understand his concerns about the pacing of the bill. He wants to read the bill. He wants to have a measured understanding. He wants his constituents to weigh in. He is representative of the state of Utah. I understand his concern. I also understand the tremendous amount of pressure that's being put on the American elected officials to pass something. With that in mind, it's extraordinarily difficult. Let's see what comes out tomorrow. Let's debate the substantive facts when the document is in front of us.
All right, well, Tammy, to that point, one second. Let me ask Tammy, to that point, though, there's not going to be a lot of time to debate.
Well, there isn't. And look, if Mike Lee, he's been in there for a while now, if they had actually been working on this over the years, none of this would be a surprise. They're admitting here that they really had nothing prepared, and this is the price you pay when you are not leading in the years before. before to get this out. They are now having to do it because Donald Trump is making them do it. My main point, though, is his comment about the House bill being mean. That is a shot across the bow to every Republican that he will, in fact, go public and confront them and maybe even work against them if they don't get this done for the American people. I think it was a brilliant move, and that is what we expect from a man like Donald Trump.
I think it was a brilliant move as well, Ford.
Yeah, I think that Tammy is absolutely right. Look, we know that there's only really about two questions that are in play here. That's Medicaid expansion, when it's going to sunset, and opioid funding. And essentially, look, it doesn't have to be done by next Thursday, but it has to be done by the August recess because we'll be bumping up against budget reconciliation September 30th. And we know that whatever comes out of the Senate is either going to have to go to conference or go back to the House. So we're going to have to vote one or two more times here. So this is the idea. You had to do people's business. You burned through the legislative counter. You got scared about Russian investigations, which are absolutely ridiculous. And you have to remember, irrespective of who is sitting in the White House as a Republican, whether it's Donald Trump or somebody else, you promise the American people that this is what you do. So I don't want to hear about Russian investigations. Do your job.
Yeah. On that note, though, Lena, we are also going to see there are some folks who are concerned about premiums going up. Now, we know a lot of that's baked into the cake, and it's going to happen, but there was clearly pushback on that in the House. We've heard pushback on that in the Senate as well. How do they ensure that, because to me, I really would have wished they had stuck with the original plan they campaigned on and ditched the whole thing and started from scratch. That's what I would have liked to have seen.
This is an extraordinarily complicated issue. Nobody wants premiums to go up. I'm a business owner. I employ over 200 people in a privately held family business. We have seen cost-prohibitive increases year over year that in a lot of cases put businesses out of business. The feet on the street, people in Michigan and across the great country are saying this is a system that's broken. We need to see what comes out tomorrow. Let's debate the facts when they're presented. But in the end, I'm very pleased that our Senate and our House are working so hard to find a solution that the American people need and will best serve American citizens.